Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about psoriatic arthritis. So we've talked previously about psoriasis, which is a inflammatory condition of the skin. Basically what it is an autoimmune reaction where the body starts to react to the skin cells. It starts to attack the skin cells. Because of that, the body overproduces skin cells and you get a psoriasis or basically a rash or plaque. It's like silvery scales all over the skin that makes up psoriasis. Psoriasis, of course, is the first step of the disease process, but you can get a secondary arthritis. You can actually get an inflammation of an arthritis of the joints with the presentation of psoriasis. Now, that being said, some individuals, although they aren't diagnosed with psoriatic arthritis until they are diagnosed with psoriasis, can have the pain and swelling and stiffness in the joints prior to ever having any plaques. And so they may initially have the symptoms of psoriatic arthritis and then secondarily get diagnosed with psoriasis and psoriatic arthritis. So what are the symptoms? Basically, swollen joints. It's very common. It will be swollen fingers and toes, foot pain, lower back pain. It can be pretty problematic and pretty symptomatic in the joints. And if it's not treated over time, you can actually get damage of the joints and significant problems. Risk factors basically for psoriatic arthritis, of course, are psoriasis, family history. If you have psoriatic arthritis in your family, it's likely that you could get it yourself as well. And age, usually the age is between 30 and 50 years old when this starts to happen. The biggest side effect, the biggest problem is the complications, is the stiff, painful, swollen joint. The problem with psoriasis and psoriatic arthritis is there's not a quick fix. There's not a solution or treatment for psoriatic arthritis. So typically it's just symptomatic treatment. So similar to other arthritis, you're going to actually treat the symptoms, anti-inflammatories, steroid, for example. MLS laser may work. As you do laser to the joints, you can actually decrease the swelling and decrease the symptoms because of decreasing the swelling. So if you have psoriasis and you have swollen, painful joints, especially if you start getting painful joints at the fingertips and toes, psoriasis or psoriatic arthritis is a possible problem. Because psoriatic arthritis, as opposed to some of the other arthritis, is very common to the very tips of the toes, the very tips of the fingers. This is Dr. Brandt Gibson, and this is your Podiatry Tips, Day 130, Psoriatic Arthritis.